Welcome to Module 2, REDCap tutorial. My name is Brittany Allen, and I serve as a Deputy Project Director for the Kentucky Opioid Response Effort. Module 2 contains an overview of the data collection procedure using the REDCap data collection system. Information in this module is also included in the data collection manual. As you learned in Module 1, GPRA stands for the Government Performance and Results Act. The GPRA Core Client Outcome Measures data collection tool was developed by SAMHSA's Center for Substance Abuse Treatment. It uses client-level interview questions to assess several aspects of a respondent's background, including substance use, criminal activity, mental and physical health, family and living conditions, education and employment status, and social connectedness. As part of their standard practices of clinical care, service providers that receive core funding are required to collect GPRA information from all clients diagnosed with a primary or secondary opioid use disorder. When you complete a GPRA interview, you will enter the data into a web-based data collection system called REDCap, which stands for Research Electronic Data Capture. REDCap is accessible on any device with internet access. User-specific accounts are not needed. Data that is entered into REDCap is encrypted, secure, and regularly backed up. Most importantly, REDCap can simplify data collection by eliminating the need for paper and pencil interviews, and it can improve data quality. When you are ready to enter GPRA data, you can click on the Core GPRA Interviews landing page link seen here. I would suggest that you bookmark this link on your browser so that you can easily access this page when you need to conduct an interview. On the landing page, there are links that will direct you to the start page of the interview that you plan to conduct. That includes the baseline interview, and the 6-month follow-up interview. As a reminder, you should not enter follow-up interview data for a client before you enter their baseline interview. For discharge interviews, there are two choices. Select I conducted a discharge interview to collect or input discharge data for a client that has been discharged from your program according to your agency's existing discharge policy. Select a discharge interview was not conducted if the client is being discharged administratively. As mentioned in Module 1, if a client is discharged or stops receiving services within 7 days of intake, an administrative discharge can be performed. Also on this landing page is a link to the Locator Information Entry page. On this Locator Information page, you can directly access the locator form to enter or update client contact information that will assist in locating the client for the subsequent follow-up and provision of the gift card. At baseline, it is important to collect as much locator information as possible, especially a current address and phone number, date of birth, Facebook name, and several good contacts who can help locate the client. At the end of the baseline interview, you will automatically be redirected to a REDCap link to enter locator information. At discharge, you will be asked if any of their locator information has changed or if they have new information to provide. If they say yes, you must complete a full locator form. If they say no, you will be redirected to the end of the form. Once you submit the locator information, you will be given the option to download a PDF copy for your records. Following the baseline and discharge interviews, REDCap will prompt you to give the client the follow-up information sheet. You must verify that clients have received the follow-up information sheet detailing the follow-up process, including compensation. It is important that all clients receive this document. Please reach out to your supervisor or your core implementation specialist if this form has not been provided to you. Next, we will walk through the data entry process for a baseline interview. To start, we will select Core GPRA Baseline Interview. From there, we will be redirected to the baseline interview landing page. On this page, you will enter the client ID and upon submission, begin the baseline interview. In order to maintain confidentiality throughout the GPRA interview process, each participant will be issued an 8-character client ID. Each question will begin with the same 6 questions to determine each participant ID. Each program is assigned a 3-character ID by UK. These 3 letters will be the same for all interviews completed by anyone within your agency. Additionally, each participant will have a unique 5-character ID that should remain the same throughout all waves of data collection. This ID will be determined by answering these 5 questions. What is the letter of the city you were born in? What is the first letter of your mother's first name or your father's first name? What is the first letter of your mother's first name? What is the first digit of your social security number? What is the last digit of your social security number? The first question of each interview will offer a drop-down response listing each core participating agency and their 3-character ID. Be sure to select your agency from this drop-down box for each interview. In this example, the selected agency's 3-character ID is ADA. Next, you will ask the client the remaining questions to determine the unique 5-character ID. In this example, the client was born in Lexington. Their parents' names are Ellen and Charles, and the first digit of their social security number is 1, and the last digit is 9. Therefore, their client ID is ADALEC19. You will use this ID for all of this client's GPRA interviews going forward. Please note that at no time should a client's name or other identifying information be entered into a GPRA interview or as the client ID number. We suggest that you practice entering the GPRA interview before your first interview with a client. In those instances, please enter practice as the client ID, so that any data that you enter is not confused with actual client data. So after you enter the full client ID, you'll need to click Submit to move on to the next page. Please note that once you click Submit, you will not be able to go back or return to the previous page. So please ensure the accuracy of the client ID and client data as you move through the interview. Before beginning the interview, you need to select whether this client is receiving treatment or recovery services. That is, are your core funded services considered to be a treatment or recovery program? Also, you need to input the date the interview was completed. If completed the same day the data is being entered, simply click Today, and the current date will automatically be populated. Click Submit to start the interview. In the first section, you need to input the client's behavioral health diagnoses. Please note that all questions with the text "must provide value" are questions that require a response. If you do not input a response to these questions, the system will not allow you to move forward to the next section. You can select up to 3 diagnoses. For each diagnosis selected, please indicate whether it is primary, secondary, or tertiary, if known. Only one diagnosis can be primary, only one can be secondary, and only one can be tertiary. In this example, the diagnosis selected is opioid use disorder uncomplicated, and it is the primary diagnosis. Next, you would select the secondary and tertiary diagnoses if known. Remember that only clients with a primary or secondary opioid use disorder are required to complete the GPRA. For those programs that do not know client diagnoses, for example, recovery support programs that do not have access to client clinical records, you should select Don't Know as a primary, secondary, and tertiary diagnoses. The next question ascertains whether the client was diagnosed with an opioid use disorder in the past 30 days. If yes, you then need to select whether or if the client received an FDA-approved medication to treat their opioid use disorder in the past 30 days. A similar question is then asked about alcohol use disorder. Next, you should indicate if the client was screened by your program for co-occurring mental health or substance use disorders, and whether or not they screened positive. Click Submit to move forward. While it is recommended that each interview be completed in its entirety to ensure data quality, if an interview must be interrupted and completed later, the interview should select Save and Return Later, which you will see at the bottom of each data collection page. Clicking on this button will issue a unique return code, as seen in the example here. Please make note of the return code in order to gain access to the interview at a later time. Click Close to access the survey return link. On this page, the required return code is again listed, and you can bookmark this page in order to return to the survey later. Or you can enter your email here, and the survey return link will be sent to you. If you made a mistake, simply click Continue Survey Now to continue the GPRA interview. The next part of the survey will ask questions about planned services. This part of the survey should be completed by you, the program staff. Identify the services you plan to provide to the client during the client's course of treatment or recovery. Be sure to click a yes or no response to each service. Although responses are not required for these questions, it helps to ensure data quality and avoid the appearance that these questions were skipped during the course of the interview. In addition to the options listed here, you will be prompted to indicate whether you will provide other services, including screening, brief intervention, referral to treatment, individual or group counseling, case management services, medical services, aftercare services, education services, and/or peer-to-peer support services. For a thorough description of each type of planned service, please refer to the core GPRA question-by-question guide provided to you by your supervisor. In this section, you will collect demographic information on the client, including their gender, ethnicity, race, and date of birth. These questions are only asked at baseline. While some of the information may seem apparent, ask all questions for clarification. Do not complete a response based on the client's appearance. You must ask the question and mark the response given by the client. Note that all clients are not required to answer these questions and can refuse to answer if they choose. But please reassure the client that their responses are confidential and will not impact their receipt of treatment or recovery services. This section contains items to measure alcohol and other drug use in the past 30 days. To ensure that the client understands the terms you are using, you may need to use slang or local terminology for the different technical drug terms. Be attentive to the client and what words he or she uses. Ask specifically about behavior in the past 30 days. Do not use in the past month as a substitute. This may lead to confusion and inaccurate responses. For example, if the interview occurs on May 15th, the past 30 days covers April 15th to May 15th. Specifically, you will record the number of days the client used any alcohol. That could include beer, wine, liquor, or grain alcohol. Alcohol to intoxication. This refers to the days where the client drank 5 or more drinks in one sitting or within a brief period of approximately 1 to 2 hours. Alcohol to intoxication. This refers to days where the client drank 4 or fewer drinks in one sitting and felt the effects of alcohol. That is, they felt buzzed, high, or drunk. This counts as alcohol to intoxication. Illegal drugs. Examples include the unprescribed use of prescription medication or misuse of prescribed medication, misuse of over-the-counter medications to get high, misuse of over-the-counter products such as rubber, cement, aerosols, or gasoline, which are sniffed, huffed, or otherwise inhaled to get high, the use of marijuana, whether prescribed or not, and the use of nicotine, including cigarettes, cigars, chewing tobacco, or snuff by clients under the age of 18. If the client indicates the use of illegal drugs in the past 30 days, you will then record the number of days in the last 30 that the client reported any use at all of a particular substance. Prompt the client with examples, again, using slang and brand names of drugs for each specific category. You may use local slang terms for any particular drug that is used in your area. For example, here you should ask the client, during the past 30 days, how many days did you use cocaine or crack? If the client reports at least 1 day of use, you would then ask, what was the route of administration? And read the options, which include oral, nasal, smoking, non-intravenous injection, or intravenous injection. If the client has difficulty understanding what is meant by route of administration, you may say, how did you most commonly take the drug? For clients that indicate more than one route of administration for the same drug, input the number of days the drug was administered through the most severe route. Oral is considered the least severe, and intravenous injection is considered most severe. This section pertains to the client's living situation during the past 30 days, as well as the impact that his or her drug or alcohol use has had on his or her stress levels, emotional well-being, and involvement in important activities. The first question listed here asks, in the past 30 days, where have you been living most of the time? Read this item as an open-ended question and then indicate the client's response in the appropriate category. You can check only one response. So if the client has been living in more than one place for the past 30 days, count where he or she has been living the longest. This section collects information about the client's educational and financial resources. Questions include whether the client is enrolled in school or job training, what their highest level of education is, and whether they are currently employed. To determine employment status, focus on the status during most of the previous week to determine whether the client worked at all or had a regular job but was off work. Only legal employment is counted as employment. To determine whether the client is employed full-time, part-time, or why the client is unemployed, you may read the response categories as a probe. The next question asks about the amount of money received by the client in the last 30 days. Do not count money earned by a spouse or other members of the household, only money earned by the client. Money received can include wages, public assistance, retirement, disability, non-legal income, family or friends, or other options such as gambling, child support, alimony, or recycling. This section asks basic information about the client's involvement with the criminal justice system. It gathers information about arrests and incarceration or detainment. Even if the client is court mandated to treatment, these questions must be asked, and the client's answers must be recorded. There may be additional information that was not part of the court mandate. Some clients may be reluctant to offer this information. Again, please reassure them of the confidentiality of the information that they are providing. This section addresses issues of mental and physical health, as well as substance use treatment experiences in the last 30 days. This section also includes questions about sexual activity in the past 30 days. This activity can be with main partners or anyone else with whom the respondent has had sexual activity. This includes both male and female partners. We do understand that asking questions about sexual activity can be uncomfortable or perhaps embarrassing for both you and the client. However, you are required to ask these as part of the GPRA interview. Of course, some clients may be reluctant to offer this information. Please reassure them that all of their responses are confidential. Social connectedness is the final section of the GPRA interview. This section addresses the client's use of social support and recovery services during the 30 days prior to the interview. Once you have entered the client's responses and click Submit, you will be directed to the Thank You page. Click Submit again to be automatically redirected to the GPRA Locator form discussed earlier in this module. Reassure the client that this information will be kept in a separate place from their other interview answers, and inform that this information will help to get in touch with them when it's time for their follow-up interview and to send them their gift card. Requested information includes the client's current address, date of birth, and social media, such as their Facebook. You will also request that they provide the 3 best addresses and phone numbers of people who will always know where to locate them. Reassure the client that you nor your agency will tell these contacts anything, except that they have been asked to take part in a health study. The space provided at the end of this form is to collect and note any additional information that the client provides. Finally, you need to indicate that you have provided the follow-up information sheet discussed earlier in the module. Upon clicking Submit, you have completed both the baseline interview and the locator form. Each program will be issued a core GPRA interview tracking form. This spreadsheet will be maintained internally by each program to track each participant's name, client ID, date of birth, interview completion dates, interview due dates, and whether each interview has been entered into RECAP. It is recommended that this Excel form be updated immediately after an interview has been completed, but please be sure to input the client ID before submitting the survey on RECAP. Also, it is important to note that the form has been automated to populate the due date columns for follow-up based on each participant's baseline completion date. Please ensure the accuracy of these data entered into this form. Once submitted, agencies cannot access the data through the RECAP system. If modifications to existing interview data are needed, providers should submit the core GPRA data modification request seen here to UK research staff. Please provide the client ID, time point of the interview, interviewer initials, the section of the interview, and the nature of the specific modifications. UK research staff will then make the requested data changes. The next few slides are links to question-by-question webinars for each section of the GPRA. These webinars will walk through each question of each section in detail. Visit the links listed here if you want additional training on conducting follow-up or discharge interviews. You've reached the conclusion of Module 2 REDCap tutorial. If you have additional questions, please reach out to your implementation specialist. Next, please watch Module 3, which will review how to track your agency's GPRA data collection progress and answer some frequently asked questions. Thank you for watching.